There are a lot of things to think about when it comes to a chronic health condition such as kidney disease. There's certainly a lot of stressors that go along with having a health condition such as CKD. So things like physical discomfort and pain, interrupted sleep, all of those things that are happening in the body. There can also be side effects from medications, frequent medical appointments that require people to miss work and school. So all of those are certainly stressors that can contribute to mental health challenges. And also, the anxiety and uncertainty that can come along with a serious medical condition. What are the next few weeks, months, years going to look like? All of those sort of fears and worries that come up when faced with a serious medical condition. There are also some direct impacts of the illness and treatment itself. So things like uremia, as toxins build up in the blood, there can be an impact on the brain. So, attention, concentration, mood can all be particular challenges as kidney disease progresses. And so we know that some of those things contribute. There can also be other things that go along with CKD, like anemia, for example. So when people have low iron, they might feel more fatigued. There might be a bit of an impact on their mood. So all of those things put people at an increased risk for having some challenges with their mental health. We do have enough research to tell us that risk of depression, for example, is higher in patients with chronic kidney disease and who are on dialysis. So, for example, we know that rates of depression are 3 times as high in adults with end-stage renal disease compared to the general population. And so that's really quite concerning. We also know that there's research accumulating that risk of anxiety is higher as well. It's important to note that the majority of adults and young people with chronic kidney disease are doing just fine in terms of their mental health and their relationships and that type of thing. But then, of course, there is a subset of adults and children who really do struggle and who feel very challenged in terms of things like mood and anxiety. So I think it's important to recognize that low mood or depression or a significant anxiety concern is different from just a normal reaction to a stress in life. So the reaction would tend to go on, for quite a period of time, so longer certainly than a couple of weeks. So if someone is feeling low and sad or very anxious, most of the day, more days of the week than not, and that goes on for a period of time, when we're into sort of many weeks or months, then that's an indication that people could really benefit from additional support. And the other thing to look out for too is just the impact on the person's day-to-day life. So if the struggle with mood or anxiety is getting in the way of getting to work or getting to school, doing normal activities that the person enjoys, if they're not able to do those things in the same way, then I would say that that's a red flag as well for some extra support. It's important to think about sort of going back to the basics. So things like healthy eating, prioritizing enough time for sleep, getting exercise is a really critical piece. And there's research that's growing to show us that exercise in and of itself can be really helpful for things like mood and anxiety. Also getting outside. For adults, it's really important to avoid drugs and alcohol, which might in the short term give some relief from things like low mood, but in the long term typically make it more complicated. Managing stress, reducing stress whenever possible, calling in your support system, seeing if there are some things in the course of your week that you could, give up for a period of time, doing things like yoga or meditation, whatever you do in your life to manage stress, anything that gives you relaxation. It can also be really helpful to connect with other people. So making sure that you reach out to your friends, your family, your support system. And so that might just be, informal, going for a coffee. It can also be more formal, like getting support from other people in the kidney community, through the Kidney Foundation, the different supports that are available. So all of those things can really go a long way to helping people manage stress, which then can have a positive impact on their mental health. If those struggles like a low mood or anxiety go on for quite a period of time and it is getting in the way of day-to-day life, then it is time to think about asking for help and support. So for adults, a really important person to start with would be your family doctor. Also your kidney care clinic team. Those are all really good sources of information and resource, and those members of your team can certainly direct you to other resources that exist in your area that can help with mental health. Some people can access counseling through their employee assistance program, so that can be something really helpful for adults to look into. And then when it comes to crisis services, it's also really important to know that those exist 24/7. So, in your local area, there will be crisis services and crisis lines that can click in if someone really needs in-the-moment support. Treatment for things like depression and anxiety in people with complex health conditions really look about the same as they do for the general population within a framework and a context of the medical condition. And so, when we're thinking of something like depression, for example, when the symptoms are in sort of the mild to medium range of severity, really what we look at is therapy as an option first. And so cognitive behavioral therapy is one of the most evidence-based interventions for both adults and for children with things like low mood or depression. Of course, it looks a bit different with adults and with kids it's much more play-based and free-flowing. But really that type of work is all about the connection between thinking, feeling, and behaving, and how that all goes together to impact mood. When you move more into the sort of medium range to severe range of symptoms, at that point it's a consideration whether there might be an additional medication that could be helpful. And usually it's a combined approach of medication and therapy together is what the evidence shows us has the best impact. And so, it's quite common for me to ask my psychiatry colleagues here at Children's Hospital to consult with a family to see whether or not a medication might be appropriate. Some family doctors and pediatricians are also experts when it comes to those types of medication options. So there's a lot of consultation and interdisciplinary work when symptoms are really troublesome to a child's or an adult's day-to-day life. Oftentimes that combined approach of therapy plus medication is the package we need to put together to get them some relief. There are a couple of key websites that I can recommend. There's so much on the internet these days, and some of it is good and some of it is not as good. So there are a couple of key places that people can go that can then sort of be a hub for connection with other resources. So for adults, the Anxiety Canada website is a really great source of information. And actually, both for adults and for children, they have resources that are really across the age span. So if there are concerns about anxiety, certainly Anxiety Canada is a great source of information. The Canadian Mental Health Association website is another really great source of information. And there's some really great programs that are offered through the Canadian Mental Health Association. Things that are quite unique, like telephone coaching and online services. So certainly the Canadian Mental Health Association is a good source of information. And then the other one specifically for children and youth is the Kelty Mental Health website. And the Kelty Mental Health Resource Center is housed here at Children's Hospital. They have an amazing website. They also archive things like expert presentations, webcasts, things like that. And so that's another really great source of information around really mental health broadly in young people.